Did you know your blood oxygen levels drop to 65% while you sleep? Currently, 38% of adult men worldwide suffer from sleep apnea, and a staggering 91% have no idea their condition exists. The most terrifying fact is that untreated, sleep apnea increases heart attack risk by 4.6 times and stroke risk by 3.9 times. Leading international medical universities report that severe sleep apnea patients live an average of 11 years less than healthy individuals. But today we're revealing revolutionary exercise methods that can overcome this deadly condition. Prepare to discover the breakthrough treatment protocol, developed by globally recognized medical experts. The hidden killer in your bedroom. Sleep apnea isn't just severe snoring. It's a serious condition where your airway repeatedly collapses during sleep, stopping breathing for 10 seconds or longer. Large-scale clinical research published in prestigious international medical journals shows that severe patients experiencing over 30 breathing interruptions per hour suffer cumulative brain damage. The cascading effects are even more frightening. Oxygen deprivation causes irregular heartbeats, blood pressure spikes, and explosive increases in cortisol stress hormones. World-renowned research teams conducting comprehensive clinical studies found that sleep apnea patients have nighttime cortisol levels 5 times higher than healthy individuals. Imagine this happening every night for 6 to 8 hours. Your brain and heart are literally fighting for survival while you sleep, completely unaware of the battle raging inside your body. The most insidious aspect is patient ignorance. Since episodes occur during sleep, there's no conscious memory, leaving only morning fatigue and headaches. Most people mistakenly attribute these symptoms to simple tiredness or stress, never realizing they're slowly suffocating each night. How exercise opens your airway. How can exercise open blocked airways? Let me explain the scientifically proven mechanisms published in renowned international medical journals. First is pharyngeal muscle strengthening. When throat muscles weaken, airways collapse easily during sleep. Targeted exercises strengthen these muscles, maintaining open airways throughout the night. Global medical research teams conducting meta-analyses report average pharyngeal muscle strength improvements of 47% after 12 weeks of focused training. Second is weight reduction effects. Fat tissue around the neck and tongue base compresses airways significantly. Research shows that 10% weight loss improves sleep apnea indices by an average of 28%. Third is tongue muscle control enhancement. Tongue retraction often blocks airways during sleep, but specialized tongue exercises prevent this. Leading international medical universities report that 78% of mild sleep apnea patients experienced symptom improvement through tongue muscle exercises alone. Fourth is breathing pattern optimization. Improving nasal breathing capacity and strengthening respiratory muscles enhances airflow within airways. This reduces airway wall vibrations, simultaneously improving snoring. The miraculous airway opening exercise protocol. Now I'll reveal the specific exercise methods validated by world-class medical teams through large-scale clinical trials. First are tongue strengthening exercises. Extend your tongue forward maximally and hold for 10 seconds. Then press firmly against the roof of your mouth for 10 seconds. Next, stretch your tongue left and right, maximally, holding each direction for 10 seconds. Perform this sequence 3 sets daily, 10 repetitions per set. Though simple, this simultaneously strengthens tongue base and pharyngeal muscles. Second are neck muscle strengthening exercises. With your head tilted back, place your tongue against the roof of your mouth and swallow 20 times. Then face forward and draw your chin toward your chest, holding for 15 seconds, repeated 10 times. These exercises increase muscle tension around airways, preventing collapse during sleep. Third are respiratory muscle strengthening exercises. Use diaphragmatic breathing as the foundation, extending exhalation time to twice the inhalation duration. Inhale for 4 seconds, exhale over 8 seconds, repeated 20 times. This strengthens the diaphragm and intercostal muscles, dramatically improving breathing efficiency. Fourth are oral facial muscle exercises. Open your mouth wide and make an ah sound for 5 seconds. Then close your mouth and puff your cheeks for 10 seconds. Finally, purse your lips in a whistle shape and hold for 15 seconds. Repeat each movement 10 times to expand oral cavity space. Sleep position correction and environmental optimization. Alongside exercise, sleep position and environmental improvements are crucial. Analysis by internationally recognized medical expert groups shows that position changes alone improve 42% of mild apnea cases. The most dangerous position is sleeping on your back. Gravity pulls the tongue and soft tissues backward, blocking airways. Side sleeping is safest, with left side sleeping additionally, reducing heart strain. Pillow height is also critical. Too high causes excessive neck bending, narrowing airways, while too low allows tongue retraction. The ideal height maintains the neck's natural C-curve. Bedroom humidity control is essential. Humidity below 40% dries airway mucosa, causing swelling, while above 60% increases allergic reactions. Maintaining around 50% is optimal. Special weight loss exercise program. Over 72% of sleep apnea patients are overweight or obese. Renowned international medical journals feature special programs that simultaneously achieve weight loss and airway muscle strengthening. Moderate intensity cardiovascular exercise 3 times weekly for 45 minutes is essential. Swimming is most effective because water resistance naturally strengthens respiratory muscles. For non-swimmers, brisk 45-minute walks are excellent alternatives. Strength training twice weekly should focus on upper body development, particularly shoulder and neck muscles. Push-ups, pull-ups, and dips are effective bodyweight exercises. Perform 15 repetitions for 3 sets each. Yoga and Pilates are extremely beneficial, releasing neck and shoulder tension while improving breathing control. Weekly practice significantly enhances overall sleep quality. Nutrition management and lifestyle improvements. Dietary improvements are as important as exercise. Large-scale international cohort studies identify sleep apnea aggravating factors to avoid. First, eliminate alcohol. Alcohol relaxes pharyngeal muscles, promoting airway collapse. Research shows evening alcohol consumption increases apnea episodes by an average of 68%. Second, avoid eating within 3 hours of bedtime. Stomach distension compresses the diaphragm, making breathing difficult. Keep dinner light with easily digestible foods. Third, consume anti-inflammatory foods. Chronic inflammation worsens airway swelling. Regular consumption of omega-3 rich fish, antioxidant-rich berries, ginger, and garlic reduces airway inflammation. Smoking directly causes airway inflammation and swelling. Smoking cessation is essential for sleep apnea treatment, with research showing significant swelling reduction within 4 weeks of quitting. Staged recovery process. How long must you maintain these exercises and lifestyle changes to see results? Leading international medical universities reveal predictable recovery stages. Week 1 brings subjective sleep quality improvements. You'll experience morning refreshment and reduced throat dryness, while objective apnea indices haven't changed significantly. Shallow sleep awakenings decrease. Weeks 2 and 3 reduce snoring volume and intensity. Family members typically notice changes first, as increased muscle tension reduces airway vibrations. Week 4 shows noticeable apnea frequency reduction. Mild patients often reach normal ranges during this period. Daytime drowsiness and fatigue significantly decrease while concentration and memory improve. Around week 8, moderate patients experience substantial improvement. Blood oxygen saturation stabilizes and heart rate variability normalizes. Cardiovascular risk reduction becomes apparent. At 12 weeks, maximum effects appear in most patients. Even severe patients often improve to moderate levels, with dramatically enhanced quality of life. Additional secrets for maximizing results. Beyond basic exercises, special methods can maximize effectiveness. World-class medical teams discovered additional factors through large-scale clinical research. First is singing. Vocalists have sleep apnea rates 1/3 that of the general population because singing naturally strengthens respiratory and pharyngeal muscles. Just 20 minutes of daily singing provides substantial benefits. Second is oral exercise devices. Specially designed devices strengthen tongue and oral muscles more effectively than manual exercises. Research shows devices produce twice the improvement speed with 15 minutes daily use. Third is hot showers and steam inhalation. Hot showers or steam inhalation 1 hour before bed reduces airway mucosa swelling. Though temporary, this provides immediate effects improving sleep quality. Fourth is stress management. Chronic stress increases inflammatory responses, worsening airway swelling. Meditation, yoga, and deep breathing techniques enhance exercise effectiveness by over 32%. Your body possesses far greater healing capacity than you realize. Small changes starting today will completely transform your life within months. For more information about overcoming sleep apnea and achieving healthy sleep, subscribe, like, and hit the notification bell. We're cheering for your healthy nights and vibrant days.